G'day everyone. So last time I checked for my patient's breathing and unfortunately it wasn't there. So it's time to start cardiopulmonary resuscitation, also known as CPR. CPR is the process where we assist oxygen to go to the lungs so it can then go to the brain and other organs, keeping the patient alive. So to start off, you want to kneel next to the patient's torso and remove any clothing. Start by putting the heel of one hand on the patient's lower sternum. Place the other hand on top and lock the fingers. Now perform 30 compressions at the rate of 100 to 120 compressions per minute. That's about 2 compressions per second. Make sure that you go about 5 centimeters deep and allow for full recoil. Keep in mind that rib fractures are very common during CPR. However, this is an acceptable consequence, as the alternative is death. Once you've done 30 compressions, now it's time to give 2 rescue breaths, if you're willing to give them. Start by tilting the head back, lifting the chin and blocking the nose. Then place your mouth on the patient's mouth and give 2 rescue breaths, observing the rise and fall of the patient's chest. If you can't see a rise and fall in the patient's chest, this could be because there's an airway obstruction. It can also be because you haven't blown enough air into the lungs, or there isn't a good enough seal around the mouth and nose. Keep doing CPR until the patient becomes responsive, the patient starts breathing, or when ambulance arrive and ask you to step aside so they can step in. Now keep in mind that CPR is very exhausting. So utilize any bystanders around you at the recommended interval of 2 minutes. Now, in conjunction with CPR, we also use defibrillation, which I'll be covering in the next video. Thank you for listening and stay safe.